So my name's Kirsty and I'm one of the clinical psychologists in the Eating Disorder Service. So we are a team of individuals made up of clinical psychologists, cognitive behaviour therapists, specialist dietitians, a family therapist and a team secretary. And we offer an outpatient psychological therapy service with dietetic support to adults over the age of 18 across a variety of geographical areas for people with eating disorders including anorexia nervosa, bulimia nervosa, binge eating disorder and other eating disorders that don't fall into those categories. We aim to provide a safe and supportive space for people to develop an understanding of their difficulties and ultimately aim to try and address some of those difficulties. We offer various psychological interventions including cognitive behaviour therapy, compassion focused therapy and other interventions including CAT informed work on occasion as well. And we often have trainee clinical psychologists working with our service. In terms of any physical consequences of eating disorders, we liaise with GPs. We don't have any medical doctors in our service, but we'll liaise with GPs so that any physical consequences of eating disorders are safely managed and monitored. So our philosophy is that individuals can recover from eating disorder even if they've struggled with these difficulties for a number of years, which is very, very common. And we know that people can overcome their difficulties if they're willing to work hard and work collaboratively with us as professionals. So during the assessment you will meet with one of our specialist team members, either a cognitive behaviour therapist or a clinical psychologist. The appointment normally lasts for about 90 minutes, so an hour and a half, and it's an opportunity to discuss the current difficulties. We'll think about current kind of dietary intake and fluid intake and physical and psychological health concerns, and we'll also kind of have a brief overview about the onset and any understanding around the eating disorder. In the assessment, people are weighed in order for us to calculate what we call BMI, body mass index, and we recognise that that can be a bit distressing for people or concerning for people, but we are aware of that and we will support anyone to kind of manage those feelings in the assessment. And at the end of the assessment appointment, any options for treatment will be explored with the individual. And those things, as I mentioned before, could include cognitive behaviour therapy. We offer compassion focused therapy both on an individual and group basis, but those options will be discussed in more detail at the assessment. So this is Mark, and he is my colleague in the Eating Disorder Service.
Yeah, hi, so as Kirsty said, I'm Mark, I'm a clinical psychologist and working with Kirsty. So we were thinking that there are many points that people have raised in terms of their concerns about attending assessment in our service.
Yeah.
So we were thinking we could address some of those here.
Yeah.
So the first point being that...
So one of the concerns that people raise is that the distance to the clinic is too far to travel. And we are able to address that in terms of offering assessment appointments at a variety of locations. We do cover a very wide geographical area in our service, and so so sometimes people do have to travel a little bit further from where they live, but we do have assessment clinics dotted across those different geographical locations, and so please do raise that with our team secretary on the phone if that is a concern that you have, because you can be accommodated.
And then I think a second point was the concern that someone's problems aren't severe enough, or they're not unwell enough, or they're not underweight enough to be offered a service. And what we'd say to that is that we don't have any exclusion criteria in terms of weight, that we see people from a broad range of weights, and body mass index weight has nothing to do with whether someone be accepted into our service. And we see a wide range of severity of presentations in our service.
And different